You're watching Fios 1 News. I'm Nancy Ward. Well, October is Breast Cancer Awareness Month, and breast cancer is the most common cancer in women in the U.S. But if detected early enough, of course, it is highly curable. What many women don't know is how to check properly for concerning signs. Joining us now with information on what to look for is oncologist Dr. Daniel Fast. Doctor, thank you so much for joining us.
Thank you for having me, and good morning.
Good morning to you. Obviously, a big topic. My first question is, history of breast cancer does run in my family. So does that make you at a higher risk, me at a higher risk? And do other women pose as a higher risk because of that?
Yes, a family history of breast cancer does put a woman at an increased risk of developing breast cancer herself. So she would probably want to speak to her physician about what steps she should take to have surveillance for breast cancer and whether or not she should start at a younger age, younger than 40. But each of these is an individual decision best discussed with your own physician.
So starting at what age? You just said younger than 40. Should I be concerned if a woman in her maybe mid-30s has it in her family? Should we go now?
You might be, and the other thing you might want to look into is BRCA testing.
Right.
BRCA is a gene that puts women at an increased risk for breast cancer, and you could be tested for it. And if someone in your family is tested positive for it, then you'd absolutely want to investigate having that test done. It's done through a blood test, but these are readily available and things that women could think about availing themselves to if the situation warrants it.
So what does this screening consist of?
The most common screening is self-exam, a physical examination by your gynecologist, and an annual mammogram starting at age 40. In some women who are at increased risk, they may do additional exams, such as a sonogram or an MR, but those are not routine screening tests.
How can we help spread the importance of breast cancer screenings? I mean, word of mouth, obviously, your doctor telling you to go for a breast cancer screening, but how can we get the word out?
Well, that's what October is really all about, breast cancer awareness. So we want to make women aware that, number one, screening is important, and number two, that the disease is highly curable when found early. That's the key, because it wouldn't be worth all the resources to screen unless it made a difference. And the death cancer rate is actually declining in breast cancer because of much better treatments. So it's not something that women should fear the way they would have 20 or 30 years ago, but should be proactive about their own health. Talk to your friends. This show obviously gets the word out, and all those pink ribbons really remind people that they should talk to their doctor about appropriate screening exams.
Some good reminders, and most importantly, be proactive.
Take command of your health. Not just about breast cancer, but about everything.
About everything. Some good advice there. Dr. Fast, thank you so much for joining us.
Thank you.
Appreciate your time. We're going to be right back.